keeping Southern Maryland connected. Here's T-Bone and Heather on Star 98.3 and 97.7 The Bay.
Just a touch after 7 o'clock, 7 minutes after 8 o'clock, that is, 8:07. Good morning. Welcome to the show. We're going to jump in here because I've got Dr. Polsky on the line.
Oh, good.
And I want to chat with him. Hi, good morning, sir. How are you?
Good morning. We're doing great. How are you today?
We're doing fine. We're doing what we're always doing, and I'm sure you've been doing that as well.
Can I be honest with you, Dr. Polsky? And I recognize when I'm about ready to go off the rails, and I'm not yet, but
I am. I've been off the rails for some time.
I don't know what it is. I don't know if it's, but I find myself being angry a lot. I actually had to tell somebody on the phone the other day, I'm going to hang up with you because I don't want to say something that I'm going to regret later. And I don't know. It's just this. I mean, are you hearing that from people that they're angry or they got anxiety or what is with that?
Is this the psychotherapy part of the show?
Yeah.
I would love it if you could help with that. Sure.
Well, and certainly we've all seen that, and we've talked before that this is the first major health crisis that has been in the social media era, and we definitely get the sense that. Not that that's the only factor, but certainly that is fueling a lot. False rumors spreading around.
Yeah, a lot of that.
And then, the idea that everybody gets to make a decision about everything. Everybody's opinion is the only opinion out there. I will say that, and this may get me in a little bit of trouble. But,
yeah, good. This is the place.
I don't agree with every decision that's come out of Annapolis and Baltimore. I think overall, and I will say that everybody up there is doing things because they genuinely think that this is the best in the interest of the citizens of Maryland. But the reality is that you only have one quarterback. You have one person who needs to call the plays. No team can function well if you have everybody has their own way they want to do things. And so the approach that we have taken is not to get frustrated by things that we may have decided we would have done it a little bit differently.
Right.
But everybody pitches in. Everybody does the best they can. If that works well, great. And then if not, then you modify a little bit and go forward. And I think a lot of the anger and frustration is because everybody can't be in charge of this.
Right.
And
that's
do something differently.
True.
And I played a lot of team sports when I was a kid. If you want to have the best outcome in the end, you need to get together. You need to make it work the best you can.
Yeah. Well, also, if you really want to make sure it works out well, cheat. That is what I always learned from sports. So, Doctor, one of the things I always ask you when we check in here, any good news? What are you seeing on the home front?
Yeah, so this doesn't make scintillating radio, but it makes really good public health. It's been a pretty dull week from public
I love it.
Oh, good.
Love it.
And so what we're seeing since Easter time, I know we talked about a month ago that we thought it was really, really important for people not to congregate around the holidays and potentially spread virus, and particularly with more medically vulnerable people. And what we've seen since then is a significant decrease in the percentage of positive test results in Calvert, and I would say the same in St. Mary's.
Oh, that's great.
So right now, our tests are showing about only half of the positive rate that they're seeing among the state as a whole.
Wow.
Okay.
Oh,
So,
that is good news.
Now, as the testing goes, you may not even know the answer to this, so I'm really throwing you a curveball here. But somebody called in and said this, and I don't know. So I said, I don't know. I'll ask Dr. Polsky, see what he says. So here's what this caller said. And the caller, for what it's worth, she said she works in the health industry. I don't know in what capacity. She said, here's what happens. Somebody comes in and they test positive for coronavirus. Let's say it's Thursday, May 7th. They come in, they test positive for coronavirus. His name's Jim Smith. And the same Jim Smith comes back 10 days, 14 days later, whatever it is, and they test again, and then, well, by golly, it's still there. That would be 2 cases of coronavirus. The hospital logs it as 2 cases.
No. It's a quick and easy answer, no. So way back in the beginning, we realized that there would likely be people who would be retested. And so we do have a log of every case that happens in our county because we reach out to that person. We do contact tracing in order to be able to reach out to contacts. Obviously, we have to talk to the person who originally tests positive. For each of those individuals, we have a separate column in our spreadsheet that then would document if they have a repeat test and whether that test is positive or negative, but they do not get a new entry. So
right.
when someone looks on our websites to take a look at numbers, those are each individual, not the number of positive cases.
Right. Okay. Well, good to hear, because it didn't make sense to me either.
Okay, here was another call that came in from a gentleman who seemed pretty specific, and he said, listen, hospitals get money for every coronavirus or COVID-19 death. They get extra money for a death. He said $96. I don't know. Is there any truth to that hospitals are getting money
and then,
if somebody dies of COVID-19?
And then that's prompting hospitals to list the cause of death as COVID-19 versus, the guy was 650 pounds and had 4 bypasses.
No. And again, I'll get back to what we talked about in the very beginning, that this sounds like some crazy social media rumor that gets out there.
Yeah, well, I think a lot of it is.
That's why we have you on.
That's why we have you on, right.
And part of that is it erodes trust. So people need doctors, they need nurses, they need hospitals. And the unfortunate thing about that is not some crazy conspiracy theory. The worrisome thing is that plants a seed of distrust about what hospitals may be doing.
Mm-hmm.
And these are really hardworking professionals out there doing the best they can. It's incredibly unfair to them to even suggest that they would be falsifying records for any kind of money. Must have $96. I mean, I don't know where they come up with that, but no, they're doing their absolute best. They're testing people appropriately, and I will say that in our hospital over here at Calvert, they've just been doing a tremendous job. We've had 3 people in our county die from the virus, which individually for each of those families, it's a tragedy. But you look across at all the deaths in the country. Those are professionals that have been doing a great job. Mm-hmm. And I'll take a moment. You might have mentioned yesterday or earlier today that this is Nurses Week.
Yes, yesterday.
So, the nurses over in the emergency room and the intensive care unit, I can only imagine for the nurses up in the behavioral health ward, talked about stress and anxiety, all the hard work that they're doing to help the people who've come in for care.
Right.
Our nurses here at the health department who are manning our drive-through test center, and the nurses that are probably least appreciated, which are the nurses who work in just general doctor's offices out in the community, who do a lot of really important comfort care as well as physically taking care of their patients every day. So, I do want to take a moment to appreciate all the work that they do.
Let me ask you this. Are you familiar with the video of Dr. Erickson, and I believe he's out of California?
I'm not.
Okay. This is what Dr. Erickson is saying. And it's a video that's been out there. It's on YouTube. And it's about the COVID-19 and the responses. And this is what he says. And a lot of people are talking about this. And it goes back to what we were saying about, putting records down and how people keep track of these records. He said that doctors are being pressured. If somebody has heart disease, COPD, emphysema, and they have for years, they're diabetic, whatever, and they die of COVID-19, he says doctors are being pressured to put down a COVID-19 death. Not that the person had heart disease for years, not that the person was a diabetic, or is that what's happening? Is it taken into consideration, okay, COVID-19 exacerbated the already pre-existing condition? How is that tracked, and where is that record?
That sounds like somebody who's more interested in getting views on his YouTube videos than maybe really giving an accurate picture of things.
Mm-hmm.
Okay.
So the way that things always work, and not just specific to coronavirus, but when death certificates are filled out, they have the proximate cause. So what was the inciting? I'm not phrasing that as best I could. What is the cause, the immediate cause of death?
Right.
The underlying. So if someone had heart disease, they had COPD, they had various complicating factors, and then they were infected with coronavirus, they would not have ended up dying on that day if it wasn't for the coronavirus.
For the coronavirus, right.
Coronavirus will be listed as the cause of death.
Oh, okay.
And then there are...
but the same thing would happen if they got shot in the head. I mean, if they had a heart condition, high blood pressure, this, that, and the other, somebody drove by and shot him in the head, that it would be the gunshot that listed him as the cause of death.
Correct. And then there are additional spots on the death certificate for underlying causes that are contributors to that death.
Okay.
Right.
So then things like heart disease, COPD, diabetes would be listed, and then when the epidemiologists go through the records, then they tile that together. So that's how they can say that somebody with COPD or emphysema or diabetes is more likely to die from coronavirus because they look at the contributing factors that are also.
Let me ask you this. This is an interesting thing, and I don't expect you to have all the answers to this, but maybe just some insight would be good. So a lot of people are asking the question. So we've all been holed up now for however many weeks, and we've been in our house, primarily only in our house.
We've been hanging up on people on the phone.
Right. So when they pull back some of these restrictions and we're allowed to once again poke our heads up and go out into the world, our immune systems are not going to be as effective dealing with the day-to-day stuff that we would normally come in contact with.
Yeah, T and I have only had contact with each other and our
Right.
boy. Our
Now-
boy has had
now,
contact with no one.
For the record, I'm filthy. So that goes a
Right,
long
right.
ways. But what about people who are literally, I mean, they've just been in their house for like a month.
And having
then
food
they
delivered and, yeah.
go out into the wacky world of streptococcus and this, that, and the other.
What does that say about our immune systems? Will it be prepared when we go back out?
So I understand the logic that you're going down, but a few weeks or a few months of relative isolation will not weaken our immune systems to the point where it won't be able to fight off viruses. So there are certainly some viruses and bacteria that if you don't get exposed for years, then there can be a diminishment of immunity, but a few
Right.
weeks or a month or two is not going to make you more vulnerable.
Okay, good news.
That is
All right,
good
so
news.
we got low numbers, or at least lower numbers in Calvert County. That's awesome. The testing continues. Well, that's probably good, and maybe it could go faster, but that it is what it is. That's what we're working with.
Testing actually is going faster, so more availability. We started our drive-through last week with 100 appointments. Next week we'll have 160 appointments available, and we're getting tests back within 24 to 48 hours. So,
Ooh, that's much better than when we started all this.
in terms of reaching out to people and trying to notify them so they don't spread the virus, when we were waiting 10, 12 days, it's worthless.
Hey,
But getting it back within a day or two, we have a much better opportunity to prevent the spread.
I have one more question before I let you go because I know how busy you are. You read the news and you get on the internet and you see that there are more cases now in Nebraska and a huge spike in this place and that place. Is it because of testing? Is it because they're testing more that there is a spike in...
Or are more people getting sick?
It could be a combination. I don't know specifically. So certainly the more people that you test, the more cases you're going to find.
Right.
That's what I'm thinking.
This is a virus that people are not just staying in their neighborhoods all the time. So it very well may be that people have been, as people travel in and out of Nebraska, that the virus is getting introduced into communities that it did not exist a few weeks ago.
Right.
All right.
Okay, one more question. I'm going to let you go. So I heard a lady this morning, and this give me your knee-jerk reaction to this. Heard a lady this morning say this: "We're not going to be done with this and back to normal for 36 months."
Well, hopefully we'll have a vaccine within the next year to year and a half. What normal will be going into the fall, I think, is anybody's guess at this point. And I will put out a quick plea as restrictions continue to loosen over hopefully the next few weeks to next month, to please keep in mind that for people who are medically fragile, those are people who are over 60, and for anyone at any age, including children who have significant immune system problems, including those who have had recent chemotherapy or have other health problems, that they may temporarily be even at more risk as more people are out and about and potentially contracting the virus. Mm-hmm. So I'm not overly concerned with young, healthy people, But when young, healthy people start to mix more out in the community, they need to be very, very conscious of the fact that they potentially, even if they're feeling okay, could spread virus to family members and loved ones who may be more vulnerable. So they have to be extra careful in terms of who they're associating with, and people with underlying health conditions should continue to self-isolate as much as they can.
CalvertHealth.org. That is the website, correct?
That is correct.
All the numbers are there, all the information on COVID and the Calvert response to COVID-19. CalvertHealth.org. Dr. Polsky, thank you so much again. And I appreciate you talking and maybe waylaying some fears and getting rid of some rumors out there. We really appreciate it this morning.
My pleasure. Thank you both.
All right, see you.
Take care.
All right, it is 8:23. Phone lines are open for you if you want to give us a call this morning. Well, that's good to hear about the testing. There's like you're not counting the same person twice, because that would be
that would be bad.
Not good.
Yes.
And
but how great that the tests are negative, and it's like half of what the positive response has been, at least in Calvert County for quite a while. I think that's awesome.
I always wonder about people like that chick I was just talking about, and I know that
Debbie Downers.
Well, I don't know what their agenda is. I know it's possible that nothing will get back to normal for 36 months. It's possible that nothing will get back to normal ever. It is possible. Anything's possible. But why do you got to say it?
Right.
You know what I mean? Why are you doing that?
Well, you can say it. You can say it. But you can do it like Dr. Polsky and goes, I'm not too sure what the fall is going to look like. But, as we start to get back into it.
But that's not what she said. What she said was
I know, but
people need to get their head around the fact that normal, and she did the air quotes, normal, you're not going to see that for at least 36 months.
Or let's hope that's the worst case scenario, and maybe in a year after we have a vaccine, things will be looking brighter. That's what she needs to do, whoever she was or whatever organization she was with. I know.
It's just weird to me. It's weird to me, and I always want to go, what's your agenda? Because your agenda's not, you're not trying to figure out ways to make things better. You're only figuring out ways to highlight the worst. So what is your agenda, you evil, evil person? Because honest to God, I don't see anything other than that. I really don't. I don't see anything other than just straight up evil. If that's what you're bringing to the table, there's something wrong with you. All right, let's get a check of the weather, see what's going on.